The U.S. Justice Department is signaling it might be open to so-called safe injection sites, which are spaces for people to use drugs with protections against fatal overdoses. The department says it's evaluating the sites as part of an overall approach to harm reduction and public safety. Advocates say this is exciting news, especially as last year's total of overdose-related deaths is expected to be over 2,000 in Cook County. Joining us now with more are Dr. Kiran Joshi, Senior Medical Officer and co-lead at Cook County Department of Public Health, Erica Ernst, Board President and Interim Executive Director at Chicago Recovery Alliance, and State Representative LaShawn Ford, who has introduced legislation in Springfield on this issue. Erica Ernst, let's start with you, please. First, give us a description of what these safe injection sites are like and why you support them.
I'm a big fan of safe consumption sites or safe injection facilities, depending on the facility itself. They can be a wide variety of things. They can be from a safer bathroom, and you have your bathroom equipped with stainless steel, the door flips outward, you have a monitor, limited time in the restroom, with peers running it, all the way to a very medicalized facility like Insight in Vancouver, where they have wraparound services and recovery treatment upstairs. All are meant for a safer space for someone to consume their drugs and have a peer or someone who's understanding to reverse an overdose should that occur, or to treat wounds and linkage to care.
Of course, and when you say monitor, you mean a person who is there in the event of an overdose who can administer the appropriate medication.
Sure.
Dr. Joshi, what is the health department's take on these sites?
So this public health intervention is a harm reduction intervention that intends to reduce overdose deaths and other potential harms from drug use. And in that, I think it's really a public health success story because there's a lot of evidence, a lot of research that's gone into showing that overdose prevention sites reduce overdose deaths. They decrease disease transmission in terms of HIV, hepatitis C, and other diseases. They decrease area crime. And of course, they increase addiction to treatment and other social services. So based on this evidence, we believe that these are a vital harm reduction strategy that have clear public health benefits.
Dr. Joshi, we've used the word harm reduction a couple of times. Give us a brief sense of what that is, please, what that means.
Sure. It's an understanding that we know that addiction, for example, is a biological process. It's a chronic disease, like many others. And for many folks, immediate cessation of drug use is simply not possible. And so what do we do then? We try to prevent the harms that may accrue from that drug use, such as infections that may happen from injecting, or again, HIV or hepatitis C transmission from injecting drugs.
Representative Ford, we know that you sponsored legislation on this last year that would create the Safer Consumption Services Act. Tell us a little bit about what that act would do.
Well, it would actually save lives. That's number one. And the fact that it's proven to save lives, we need to pass this in Springfield because it's a place where people can come into a organization and get help, not just to use a drug, but to also be in a safe place that could lead them to treatment if they so choose. So it's not just about using drugs, but it's about providing care for people in a safe setting.
Erica Ernst, what do we know about how this has been implemented in other places? I think you mentioned Vancouver, for example.
Vancouver has a magical site called Insight that has medicalized treatment. So many stainless steel cubicles, nurses on site, social workers, the whole gambit. And then it has recovery, medically assisted treatment upstairs that folks can go for 30, 60, 90 days if they choose. We do know that warm handoffs definitely work in these fields. And I've been to a number of overdose prevention sites as well in Toronto that are more peer-led, more grassroots. So something like an SCS can be opened low cost all the way to high cost and super wraparound. But either way, to Representative Ford's point, the point is that you have resources available, and that you have a trusted individual there who you're going to trust for the warm handoff when and if you're ready to pursue a recovery pathway.
Warm handoff from, for example, the SDS site to maybe a rehab or some other sort of care.
A rehab, methadone, buprenorphine, housing, all of those things. Absolutely.
So, Dr. Joshi, what is your reaction to the critics who say that this might bring more drugs or crime to the area, or those who say this is, state-condoned drug use?
Sure. So I'd say, firstly, that I think partially that's a manifestation of the deep-seated stigma that we have in our society around drugs and people who use them. In point of fact, addictions are chronic diseases, just like diabetes, just like high blood pressure. And we should treat the people that have them with the same compassion that we would any other patient with a chronic disease. Regarding the specific point about crime and increasing drug use, there is no evidence that supports that. In fact, to the contrary, we found in the research that when overdose prevention sites are implemented, crime can go down in the area. Injection paraphernalia is no longer strewn about the streets or the sidewalks because it's disposed of in a safe way.
Representative Ford, we know that this bill didn't pass last year. What's been the argument from opponents of it?
Just being educated about the fact that we're going to allow people to use an illegal drug. We can't see it as allowing someone to use an illegal drug, but we have to see it as we're in a situation right now where fentanyl is on the rise and more people are dying from this drug called fentanyl. And so I think we're getting to the point now that has risen all the way to the federal level, that there's a better understanding about the need for safe consumption sites because they do save lives. And so we're working it very hard. And I'm very grateful to CRA for their leadership in this and pushing it very hard.
What, Representative Ford, what needs to happen next in order to get your legislation through or to make these sites a reality in Illinois?
We're going to keep pushing and get 60 votes and try to pass this bill before we leave in April. And CRA and all the advocates, the West Side Heroin Opioid Task Force and the doctor from the county, everybody's pushing this. So I'm very excited. And I believe that we've educated people in a way, as doctor has spoken, that this is a sickness for some, and we have to make sure we treat it that way.
And quickly before we go, Erica, 2020 saw over 1,800 overdose-related deaths in Cook County. For 2021, over 1,700 confirmed. The medical examiner anticipates more than 2,000. In 15, 20 seconds, what role does fentanyl have in this increase?
Fentanyl has a huge role because it's an unpredictable and it's an unknown, and there's so many analogs of it. Folks don't know what they're getting anymore, so they can't use the amount they were formerly using. Also, COVID plays a huge role. People trying to be responsible, self-isolating, and in turn, nobody can reverse their overdose.
Okay, a lot of work to be done, obviously. Erica Ernst, Representative LaShawn Ford, and Dr. Kiran Joshi, thanks to all three of you for joining us.
Thank you.
Thank you.
Bye-bye, team.